Well, welcome. I'm Dr. Phil Huang, Director of Dallas County Health and Human Services.
And I'm Kayla Sims. I'm a consultant at Accenture, and I've been working with Dr. Wong and the team at Dallas County for around 3 years.
So we're happy to be presenting in this new format for the NACHO 360 conference. We're going to be talking about our Dallas County Public Health Disease Analytics and Localized Investigation and Surveillance System, or we call it DALISS now. Also, Rachel Oldham, who's one of the managers at Accenture, who's been the lead, wasn't able to participate, but she's obviously a key player, as well as many of our other staff and team at Dallas County that have been working on this, and the team at Accenture. So next slide. So yeah, again, I'm Phil Huang, and there's Kayla. Next slide. So first wanted to just talk a little bit about Dallas County and some background about our county. Our mission is to optimize and protect the health and well-being of all Dallas County residents and support achievement of a better health outcomes for all. And as you can see, we do the broad spectrum of public health, and we're also human services too. So in addition to the standard public health activities, we have some of the social service programs. We have the housing choice vouchers, or Section 8 vouchers. We have a welfare program, energy assistance, weatherization. So it's really quite a broad spectrum. Now, just about Dallas County, we serve over 2.6 million residents in Dallas County, which point out is actually larger in population than 15 states. We also have 31 municipalities within Dallas County, of which the city of Dallas is just one of those. So that has some implications as we look at address validation and things as we go through the demo. Next slide. So like for many of us, we got into the sort of the data modernization through our COVID experience. COVID showed us all how public health data systems had really been underinvested in. As we dealt with the huge numbers in the COVID situation, we had this huge volume and a lot of different data sources that we had to deal with. We had limited access to many of the data systems. We literally had stacks of paper faxes and medical students manually entering in this data. And yet, trillions of dollars worth of public health policy decisions were being made based on our daily public health data for COVID. Did we need to shut down businesses, shut down schools, require masking, those sorts of things. And yet, the investment in the systems had not been made previously. And so we made a decision that we really needed to look and invest in the best sort of tools for each function that were out there, that public health shouldn't need to be settling for second-rate systems. Again, it was that having timely and accurate data was so important for COVID and for whatever else we needed to deal with in the future. We had the manual burden on our disease investigators, and so this is the system that then evolved from COVID. So next slide. So this is overview of sort of the architecture of our system. On the left side are the various data sources that we're bringing in to the system. We are getting electronic lab reports from the state as a daily feed from the state. We're also getting electronic case reports from the AIM system. That's something that at the start of COVID, we actually had no hospitals at all in Dallas County that were reporting through AIMS, and now we have at least 11 hospital systems, and just continuing to expand with those hospital and other provider EHR systems. We, in the future, we're working on TEFCA, and I'll show you that in a second, and FHIR connection. We're also getting as I mentioned, the pre-NEDS electronic lab reports from our state health department on a daily feed that we bring in through Rhapsody. We're also getting all of our post-NEDS cases from the state, sort of as a validation. So all of the closed cases are reported to us daily. That's fed in through MuleSoft. Then we also have recently integrated the homeless management information system data for our region. And also we've been getting mortality data from our vital records departments at the city of Dallas and Dallas County, as well as some feeds from the state. During COVID, we had a daily feed of our COVID vaccination through the state IMTRAC system. We're now working with them to try to get that extended for all of the vaccinations in the IMTRAC system. We're also working on environmental health. Our environmental health program has recently implemented a new restaurant and restaurant inspection electronic system that we're going to bring in. We're also working on expanding to HIV, STIs, TB to bring that data in. All of the data comes into a centralized SAS master data management system. We bring in to our inbound staging. We do address validation, and we use sort of address doctor as sort of initial screen, and then we work with our local Parkland Center for Clinical Innovation that uses a reverse geocoding from latitude, longitude coordinates on all of these, so that we can really, as I mentioned, Dallas County has 31 municipalities within Dallas County, and we really need to make those distinctions on exactly which municipality the person's in to report to those municipalities. And a lot of the off-the-shelf address validation tools use the U.S. Postal Service, and so that's not refined enough for us. For instance, someone could live in a place, it's like Highland Park, and if on a letter they wrote Dallas, that would still get to the person. And so we needed to get even more refined address validation down to that this person lives in Highland Park. So it comes into our master data management system, deduplication, and cleaning up the data. And you'll see a little bit more about that from Kayla. But then the processing, the logic to create and initiate a case investigation. We also then send the data to our data warehouse where we can put on some Power BI dashboards separately. And then anything that needs an actual investigation, we bring into Salesforce. And we chose Salesforce because we could stand it up, hundreds of contact tracing investigators in an instant. Also the CRM capabilities to use text messaging, email, and all of those things are, I think, state of the art, and we'll show you some of that at the end. And then after we do our investigations in Salesforce, and you'll see a demo of that, then the closed case, completed case investigation goes back to the state of Texas and into their NED system. And that's actually our biggest bottleneck right now, is getting the data after we've done an investigation in Salesforce back in to the state system, and we're working with them on that. We've actually built the system out for like 160 diseases, and with the state, it's limited the number that we can get back in an automated way. I think they'll take COVID and Mpox as CSV files, and about 5 conditions as a PHDC document, and the rest now we're currently having to do manual dual entry after we do the investigation in Salesforce to get it back into the state NED system. But again, with just this overview, we're trying to use what we consider the best tools for each function, best in class, MuleSoft, Rhapsody, Informatica, and Salesforce as some of the primary tools. Power BI is what our county also uses for some of the data visualizations. Next slide. One thing that we're also doing, we're one of the initial cohort of implementation centers working with the sites. And so we are working on implementing FHIR and TEFCA into the system. We have our county commissioners have signed off on the DERSA so that we have signed the TEFCA agreement. We're working with eHealth Exchange as our QHIN and working now on implementing FHIR and connecting to TEFCA. And part of that also working with one of our key partners in our community, the Parkland Health System, which is a major public hospital system in Dallas County. So next slide. So Kayla, I'll turn it over to you.
Thanks, Dr. Wong. So when working with the EPIs, it was important for them that we have built out this Link SNOMED sheet in Salesforce. That way they're allowed to update on their end and have permissions to update as new Link and SNOMED codes come out due to their frequency of change. So here on this slide, you can see a processed ELR data set. So for this has already gone through our MDM system to process it into the fields needed and clean the data for it to be transferred into Salesforce. So after this process data is sent into Salesforce, the system is going to take a look at the Link SNOMED sheet to determine exactly what test result should be created. And after that, the correct test result is created in Salesforce, including all information that's needed, the specific condition, organism, and test type. So next, I'm going to hop down into another data transformation we have in Salesforce. This one we newly got into our system, and it's taking the raw homeless data from the homeless management system, and we process it into this new record type we've built out in Salesforce to hold the homeless data. And this homeless projects record that we've built out allows, and I'll go into this more in the demo, but it allows the epidemiologist to see exactly what the person is has as far as social services. So what their living situation is, the project name they're enrolled in. And then we set up another automation that if there's any of these homeless project records related to a person, we have this flag so the epidemiologists know that the address records may not be reliable and they need to review them to make sure that person's address information is up to date. So now I'm going to hand it back over to Dr. Wong to go through the first part of the Salesforce demo.
All right. Thanks, Kayla. And can you see my screen?
Not yet.
Not yet. Okay. Is that working?
Not quite yet.
I see it on mine. You don't see that?
I do not see it yet.
Hold on. Because I actually see it on my phone too.
Okay, I wonder if it's on my end then.
And you stopped sharing on yours, right?
Yeah, I stopped sharing on mine.
Huh. That's weird because I can see it on my phone separately.
Okay, I think it might just be on my end then. So we're good to go ahead and go, and then we can just pass over sharing to me.
Okay.
Later on.
All right. All right. So this is actually a demo in UAT of our system. And this is the home screen that a epidemiologist or investigator would see. And this is sort of a line list of all the open COVID cases, although, again, we're not doing much with COVID. And then all the other conditions that were open investigations that, as Kayla mentioned, the logic for creating some of the investigations, initiating a case investigation for these other conditions. So then if the investigator clicks on one of the investigations to open up, I'm going to go into Taylor Swift here. Whoops. And in the details then for Taylor Swift, there would be a list, all of the sort of the synthesis of the background information on this person is put in this details section. And so it brings together all of the matching and merging of demographic information that came from the various data sources. And there are survivorship rules on which data is more reliable. And then within data sources, the most recent data would be put in here. And so again, all the demographic information, the address, it is Google Maps is integrated into this on the patient's address. Then all the emergency contact information, the vaccine, the enriched address information that I mentioned with that address validation comes into here. And what I wanted to show then also on the demographic information based on that person's home address and the census block that they live in. We've integrated this Parkland Center for Clinical Innovation social vulnerability compass. And so this gives a summary of the social vulnerability indicators and demographics of that census block where that person lives. And so, for instance, this block number, the population in that census block is 2691. The age distribution in that census block, racial distribution, education levels, and you've got all these other social vulnerability indexes that you can see if they're high, low, moderate vulnerability. There's a whole glossary. So there's empowered communities, equitable communities, good health, and household essentials. You can see there's actually a glossary of all the indicators. And so, for instance, in good health, you can see, it's life expectancy in that census block, some of the cancer prevalence, and some of the data sources are the places data. You can get heart disease, asthma, diabetes, again, from places data. For some of the other empowered people, we have the vulnerability indexes of like a proportion of households with broadband access from the American Community Survey data, proportion of households without a vehicle from the ACS data, educational level, proportion of population 25 and over without a high school degree. Those are just some of the examples. For equitable communities, things like average monthly housing cost as a percentage of household income, that comes from ACS data or some other H&T index, a neighborhood survey, number of nonviolent crime and violent crime rates per thousand in the last year, unemployment rates, and then also some of the household essentials, median household income, food insecurity, proportion of households on SNAP in the prior 12 months. So again, it's a whole, in a snapshot, sort of the social vulnerabilities of this person based on their home address and the census block that they live in. And so now I'm going to turn it back to Kayla to go through more of the demonstration of our system.
Thanks, Dr. Wong. Let me know when you're able to see my screen.
Yeah, I think I see it.
Okay, perfect. So hopping over into the other objects we have related to the person, if the epidemiologist hops over to this related tab, they can see all condition histories the person has, including the STI condition histories. And talking about this, I want to point out I do have the system admin profile, so I'm able to see all sides of the project. But for data security reasons, we have different profiles and permissions built out. So the epidemiologists are only going to see the records that are related to them. So if they only review communicable diseases, they'll only see this reportable condition histories. But if they're an STI investigator, they're going to see only these STI condition histories. Don't have any here, but TB and COVID cases, same thing there. The TB investigators will only see TB, and the contact tracers will only see COVID-19 cases. Hopping down a little bit further, here's that homeless projects object that I was talking about in the slides. So for this one, there's only one social service that's related to this person they're enrolled in. But if this person was enrolled in multiple social services, the epidemiologist would be able to view all of those in this list that's showing here. And I'm going to hop into that record so that we can see all the details that the EPIs can see there. So there, it's going to show the related account name, the living situation that we got from the homeless management line list, listing if they have a disabling condition, the project name that they're enrolled in, as well as the project type. And then also for the epidemiologist to determine if this is a recent record, we have the entry and exit dates. So for this person, we haven't received an updated exit date, so we'll only see the entry date into that social service. So I'm going to pop back over to the person account, still going through that related tab. We see the test results for the person. So again, this will show all test results that have come in for this person or been manually created. Same thing for vaccinations. And then this person address object is where we keep the history of all of the addresses. So here we record the start date and end date. And then we also, going back to that homeless project data, have this checkbox for the epidemiologist to check if the person is homeless, and it'll be a homeless address record. Last thing we see on this related tab is the person account history. This also allows EPIs to view everything that's been changed on the person and who made that change. That way they can go through and see if the change was made by a reliable source and see who made the change, so they can keep better track of this person. So next, I'm going to pop into a test result. This would come in through our ELR feed, or they can be manually created. Thing about this is we have the automatic creation logic on the back end for these conditions. So it's reading that LOINC SNOMED code, bringing in the test type, the condition, organism, and then based on that, the system is determining whether a condition history or investigation should be created. And hopping into the condition history, that's exactly what it sounds like. It's going to be the history of this particular condition for a person. So a person's only ever going to have one condition history related to them, but they may have multiple investigations pointing to multiple instances of the same condition. So after this is automatically created in the system, first we're going to pop over to the condition history. On this, we have very minimal information since it's going to have, this is the main landing page for everyone. Main points here is we have this related list here as well. So it's going to show all test results related to, for example, I have measles here. So all test results for measles for this person are going to live on this landing page. There's also a timeline feature. So there's only one item here, which is the test result, but this would show all test results the person has had over the lifetime of this condition, and give the users a more visual viewpoint of this. And then over on this side, the user can get a larger viewpoint of all objects that are related back to the condition history, such as any related vaccinations, any contact exposures, hospital admissions, test results like I mentioned before, and then also the epidemiologist can upload any files here that are related to the person. So next I'm going to hop into the investigation. It's taking a second to load. So here is the investigation landing page. This is where we're going to have custom questions built out for each condition. So for each condition, we're only going to see the questions that epidemiologists need to have for their investigation related to that particular condition. So I'm just going to do a quick scroll through. We have the patient information. This is going to be their work and address information related back to the specific information, reporting source, any clinical data we may have. This treatment section is one of the sections that's going to be custom. So if there is a treatment plan for the particular condition, this section will be there and have any applicable fields. the laboratory section that notes if there was laboratory testing performed, so noting if we got a test result for this or if it was manually created. Also, if it's a condition that has any vaccinations that are related, we see the vaccine information, the epidemiologist information. And then I'm also going to pop up to the log records. This is another custom piece we have built out for each condition. So these values you see right here are going to be defaulted based on what is relevant for each condition. So the symptoms, complications, risk and exposures, and then not related for measles, but if it was an enteric condition, any food histories might be related. So these values that are showing are the only ones that are applicable for this condition. Next, I'm going to hop into a different side of the project. So say it was a HIV or STI epidemiologist looking into a case. So I'm going to hop into an HIV case. Same thing here with the condition history. So this is going to be the landing page that shows all instances or any time that the DIS investigator had to look into the person. So not many fields here, and we're going to have the same related objects here. So any disease monitoring, exposures, or hospital admissions. And then we're going to pop into the investigation. This is where you're going to see the more granular data. So we start out with the reporting and morbidity data, and then move down into the other more granular sections. And again, this is going to be built out individually for each condition to only show the values that are relevant. Now I'm going to hop into what we've built out for the Ending the HIV Epidemic team. So they're going to use this new object we built out called Care Navigations, and it's related back to this original investigation. So you can see it here, and the EHE Care Navigator can hop into it from there. So they're going to be able to record on this their entry date into the Ending the HIV Epidemic program, the status here, noting the Care Navigator, any referrals they've had to give the patient. And we have this automation here for the viral load. So if there was a test result uploaded for this person doesn't have one. But if it did and it noted that they were virally suppressed, this will automatically upload to be yes. And if we hop into this related tab, this is where the investigator can note any contact requests they've had with the patients and any relevant appointments that they may have attended with the Ending the HIV Epidemic Care Navigators. Another feature we've built out for this team is some automated tasks. So this automation is based off what the status is right here. So I'm going to pop this open so you can see the other options. Right now I have it as pending, but we have other options such as already in care, confirmed negative, ER admitted, incarcerated, linked to care, out of jurisdiction, outreach in progress, rehabilitation, shelter, and unable to locate. So I already have a task opened up here that I'm going to pop into. So on this task, they're able to record the type of contact they attempted to have with the patient. So whether it was a call, text message, field visit, letter, in-person visit, or client drop-in. And based on what they select there, and I'm just going to pick call here, they can select different options such as left voicemail, unable to leave voicemail, or call disconnected. And if they select one of these options, such as left voicemail or call disconnected, this is going to trigger our system to, within the next month, create another task for them to follow up with this patient again, since they weren't able to successfully contact them. And then one item I wanted to pop back into for the communicable diseases or reportable conditions side is our disease monitoring. So you see it down here in this pop-up tab. And again, this is only going to show for the epidemiologist that it's relevant to. But in this, we built this out for conditions that have an immediate or emerging outbreak that needs to be monitored, but we may not necessarily be getting test results in for it yet. And we just want to collect those exposures for each person. So I'm going to do this for Taylor Swift again, but the epidemiologist could also create any new accounts here by clicking this button and fill in any relevant information there. I'm just going to go ahead and use that existing test account we have. So once they add this, and like I said, we only have this built out for a few conditions. So we have Ebola, Marburg, measles, or monkeypox. I'm going to go ahead and click monkeypox, and the epidemiologists are able to easily record here what their date of exposure is, if their risk level is high, medium, or low, and also if they received any relevant vaccinations. And then if they toggle this send monitoring notification, this is going to send a text message to the person's phone as long as they have a connected phone number, sending them out surveys that are relevant to seeing what symptoms they're experiencing if they're an exposed contact. So I'm going to go ahead and hit next here. It's going to take a second to load. Okay, and then it creates this disease monitoring record. So with this, it's not going to create an investigation quite yet because we're not sure if it's a confirmed instance of the condition, and we just want to monitor the person. But on this record, we're going to be able to note their exposure date, any exposure locations, the duration, and then also later on can note who they had the contact with in this source contact. And then if needed, the epidemiologist can open up an investigation. I think that was everything I had to go through in the demo on my end. Was there anything you wanted to add, Dr. Wong, or do you want me to pop it back over to you?
No, I think that was very comprehensive. Yeah, and so one of the things on that disease monitoring, like we had someone who traveled from West Africa or something, we're monitoring just for symptoms for Ebola or something. Then, if they did report symptoms on one of those surveys, then it would automate a text message or email to the investigators to notify them that they did have some symptoms that we were monitoring for. Next, I'm just going to show some of the dashboards and things that we have built into the Salesforce system that just shows how easy it is to get some of the data and see visualizations of what's going on. This is actually in production data. I'm just going to share a few dashboards. So this is our Mpox dashboard, and it's our actual cases, number of case count, cases closed that week, the number vaccinated, and hospital admissions, EpiLink cases. You can see our Epi curve that many of us may have gone through when we had that outbreak back in, I guess that was 2022. And so fortunately, the numbers since then have gone down, and you can see the other yearly Epi curve. You can see total number of deaths. You can see race, ethnicity breakdown. You can also see then this is sort of by reporting facility. And so we can see, you can hover over that. That's the most were from Parkland system, then another community-based organization. You can get that breakdown of specific organizations. You can get sort of by city counts. Most of ours are in the city of Dallas, but there are other municipalities. You can get it by reporting facilities. The classification, most of them were coming in by hospitals. And then the number, the count that were HIV positive. You can get it broken down by medications that they're on, or if they received the TPOXX treatment by HIV status, how many cases were in each of those. So again, really a lot of breakdown that you can get these data visualizations immediately from the system. I'll show you also just our enteric investigations. And again, this is in production. So you can see that various just total number of enteric epi curve by year. You can total number of investigations for this is we've got 23 through 2025, race, ethnicity. Whoops. Uh-oh. Hold on. Didn't mean to do that. You can do again breakdown by reporting facilities, residential cities, classification of the reporting facilities, whether hospitals, labs, clinics, medications, again, HIV status. Oh, this is MPOX. This is, hold on, I went back to, this is for enterics. Again, race, ethnicity, sex, the reason the investigation was closed, you can get the counts by investigator and the breakdown of which conditions they closed out with. You can get salmonella serotyping results, enteric symptoms, risk and exposure summaries. I'll show you one more dashboard. Just mention that, you know, we really appreciated the CRM capabilities with Salesforce, and you can integrate it. You can send text messages, email messages. We also, during COVID and some conditions, we've sent out text messages to the people saying the investigator wants to speak with you, please call back. We could get a queue of people who are calling into the system, and then so it's not a cold call. The investigator can just pick up from that line list of people who are on the line. But you can get now this dashboard of the total number of inbound calls by date, number of outbound calls by date, what are the peak hours that we're getting some of the inbound calls, peak number of total calls, call duration summaries. You can also get reports by individual investigators to see, you know, how many calls each investigator has done and call duration summary. So just a lot of analytics that you can also get in performance of some of the various tasks and also the CRM sort of usage. I think that's it for the dashboard. So Kayla, you want to go back to the slides?
Yes, I can hop back over to the slides. Let me know when you see my screen.
Oh, actually, I was going to do one more. I could do, this is actually, oh, well, that's fine. This is a slide, but this is actually on our live Dallas County dashboard. We had it up through COVID, but just to show you some of these dashboards, we also put out to the public. This is a Power BI dashboard for COVID. And again, if you searched Dallas County Health and Human Services COVID, you'd still see this dashboard. Even though it's no longer reportable and our numbers are way down, we still put it out there for what cases and lab reports we do get in. And next slide. Just wanted to mention that one of the other features of Salesforce that we're taking advantage of and trying to even further enhance our capabilities with is we've implemented the Salesforce Marketing Cloud for CRM so that we can customize these messaging journeys with any of the cases. And so we can set up for people to get, okay, first you get an email message, and then it can tell if they opened up the message. If they didn't open up the message, then they get another email message, say in 5 days or something. If they don't open that up, we can then set it up so that they get a text message. If they don't open up that, they can get another text message. And then then they could get a social media advertisement on Facebook or something. So there's a lot that we can really explore, and we're hoping to use further in the Salesforce Marketing Cloud. There's also, some AI capabilities in Salesforce that we could start customizing the messaging even by language or by some of the social vulnerabilities that we identified. So we're really looking forward to using this feature in the future more also. Next slide. So just overall, some of the summary of the outcomes and improvements with our data modernization, just, the data integrations, bringing all of these multiple data sources into our master data management system. We can match and merge, deduplicate, come up with a master patient index that everything is related to. We can do these direct integrations Then automation of so many manual workflows, whether it was, we estimated, we had like multiple epidemiologists initially during COVID that were doing all these address validations and things manually. Now that's all automated. The deduplication, case investigation creation. Kayla showed you some of the logic that we're integrating with the LOINC and SNOMED codes and that process. The deduplication, daily reporting and analysis. Again, we can get these real-time dashboards and visualization on what's going on. The address validation, reverse geocoding, we showed you that. This use of the patient outreach, whether text messaging, email, and again, a lot more we can even do with that, or the patient monitoring if we need to monitor someone from symptoms. And, this was, we made the point for addressing health equity. We need to have the data. We need to be able to get this data granularly, see it at the census block level, or where we need to target efforts and some of our interventions, and ultimately increasing life and healthy life expectancy through these efforts. Next slide. So we have been, we're very proud that we've been recognized for some of our the efforts. We did receive a HIMSS Davies Award for the disease investigation system, and then also received a Smart Cities Award from IDC for our system. Next slide. And I think that's all we have. So, again, we appreciate the opportunity to present our DALISS system. We'd be happy to answer any questions, or feel free to follow up with us if any questions, or if you'd like even more detailed demo or anything. So anything else, Kayla?
No, I think you covered everything, Dr. Wong.
Great. Well, thank you all. And please let us know if any other questions.
Yep. Thanks, everyone.